Hi guys, so I noticed that we have a lot of expecting parents in the class. Congratulations. We also have people who are already parents, and down the line most of you will become parents. My name is Samantha Wyrack, and I breastfed both my daughters. I have a 5-year-old and a 7-month-old. And today we're gonna touch upon your infant's fundamental needs, the benefits of breastfeeding, and then we're also gonna learn a little bit about formula a little later on today. So let's begin with the essential roots of your little loved ones. As infants, they have 5 fundamental dietary needs, and those are calcium, iron, zinc, vitamin A, D, and then vitamin B and C are grouped into their own little ones. So those are the 5 fundamental needs that your infant needs. Imagine being able to provide everything your baby needs by simply breastfeeding. So not only does breast milk carry those 5 fundamental needs, but it goes above and beyond on the list of benefits. They have antibodies, hormones, antiviruses, anti-allergens, anti-parasites, growth factors, and enzymes. So besides those 5 fundamental needs, they carry all those other things that are not included and you cannot find in any formula. You can buy the best formula, organic formula, and you're not going to find those things. Only you can provide those. Next, let's talk about breastfeeding. So when you have a baby, you're going to hear a lot, breastfeeding is the best thing you can do for your infant. It's the best thing you can do for your baby. But we don't really know why. And in the hospital, the doctors and the nurses, they push it on you a lot. And they kind of make you feel bad if you want to resort to formula. So, which is not so nice, but I just kind of wanted to inform you guys. That's my purpose today, is why. Why, breastfeeding is so important and why they push it on you so much. So did you know that unlike formula, breast milk actually changes as your infant grows? So as your infant grows, their health needs are going to change. And a perfect example of that is the percentage of fat in the breast milk will increase or decrease depending on those fundamental needs for your baby. And when you buy formula, you kind of it is what you get. Like, it stays the same, it stays consistent, it doesn't grow to your baby's needs. And I think that's just pretty awesome. According to Women's Health, breastfed babies have low risk of asthma, leukemia, obesity, eczema, which is like dry skin, diarrhea, type 2 diabetes, and SIDS. So for those of you who don't know, SIDS stands for sudden infant death syndrome. Formula. Now that we know about breast milk, I want to teach you guys a little about, now we know about breast milk, I want you guys to learn a little bit about formula so that way you guys can go out and compare and contrast on your own. Parents who do not breastfeed and decide to do the formula route spend $1,500 a year. So you will spend $1,500 annually just on formula. And that's $1,500 you can save if you decide to simply breastfeed. So formula is actually really hard to digest for your little loved ones, and it takes their tummies a long time to get used to, and that can result into like constipation, which is no good for your baby. It's super uncomfortable. Fussy babies, less sleep for mom and dad. However, formula can save lives. There are babies who are born and they cannot tolerate any kind of milk or dairy. So there's these formulas that are designed that have no dairy and no lactose. But like I said, that's a very rare instance. But there are those milks that are made for those babies. Now let's go over what's best for your little loved ones. Yes, formula has all the fundamentals. However, breast milk has way higher health benefits. You not only save money, but you also save a lot of time. You save a lot of time breastfeeding versus bottle feeding, and like I said, having to wake up and make a bottle. Now, when it's time for you to make the life-altering decision on whether you want to breastfeed or formula feed your baby, I just want you to know that you're not alone, and there are some there's these group of people called lactation consultants, and I know they were very helpful for me when every time I wanted to give up or every time my milk supply went down. There's so many resources. And make sure you use those lactation consultants. There's these people who are experts in breastfeeding, and everybody's journey is different, but they will be by your side every step of your journey, and they will help you get through it. And it's beautiful. It's absolutely beautiful, and I don't have any other words other than how beautiful breastfeeding is and how grateful I am for my lactation consultant. Now for all those future parents or people who are already parents, go ahead and reduce preventable diseases and breastfeed. Thank you so much for your time today. Thank you.